Okay, hi everyone. So weird not to see people's faces. Hi everybody. Welcome. Hi, hi, hello. I see Ziba Hyder. Hi, welcome to Music Therapy for Wellness. My name is Erin Raber, and let's go to the next slide right here. Hi, Marvel. Just a really quick just about me, just a little bit about me. My name is Erin Moraga Raber. I'm a board certified music therapist, a mental health counselor, a vocalist, and a certified sound healing practitioner. Right now, I currently work at Virginia Thurston Healing Guarded Cancer Support Center as a clinical care specialist and a music therapist, providing individual counseling, music therapy sessions, facilitating support groups and music therapy groups. Um, and I got a master's in music therapy, mental health counseling, as well as an accreditation through the California Institute for Integral Studies for sound healing. I also actually, which I don't have on here, I don't know why I did not put it on my slide, but I also recently started providing, which is most relevant to you, recently started providing music therapy groups for monthly music therapy groups for the New England Scleroderma Foundation. So, hi, everybody. It's nice to see your comments. Thank you. So this is an overview we're going to do. I'm going to give a little intro to what music therapy is, about music therapy and scleroderma, and then we're going to do experientials today because that's what I like to do. I want you to experience it and so that you really get a sense of what that is. And we'll have time for questions and answer and shares. So if you ever have a question, go ahead and put it in the chat. And we'll kind of do that throughout. All right. So, why music? In general, we all intuitively know that music can have a significant impact on our lives, our mood, our motivation, our connection. And some of those reasons is because it's processed throughout the brain. The ability to entrain to music, it helps us when we try to calm down our breath or when we really want to get moving. It's culturally relevant. It connects us with our identity and the places we come from. And it boosts natural opiates like endorphins, which have other health benefits, including a stronger immune system. For today, the focus is going to be, how a board certified music therapist sort of harnesses that power of music to help scleroderma patients heal and feel and deal with what is challenging for them. And then today, and for in terms of my approach, with a focus on voice work. So this, what you're seeing here on the screen, is the official definition of music therapy from the American Music Therapy Association. And so it says music therapy is the clinical and evidence based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy degree program. So, just a little bit more information about how music therapy works. So, one of the reasons music therapy can be so effective for so many different populations is because music experiences engage numerous centers of the brain. So, including those associated with movement and coordination, language, and sensory integration. Music also activates other structures in the brain that are associated with emotional experiences. There we go. Emotional experiences, communication between the left and right hemispheres, the reward circuitry, and basic body functions. So, music therapy is about using music to achieve physical, cognitive, emotional, and non musical goals like reducing pain or facilitating relaxation through singing, through playing instruments, through songwriting, or receptive music listening. So it uses the physical, emotional, mental, and aesthetic and spiritual facets of music to help people improve their overall health. So this is a general introduction, right? So music therapy and scleroderma. Um, Music therapy, specifically sort of toning and singing, because that's what we're going to be humming, toning, and singing. That's what we're working with today. Can help with some of the physical symptoms that scleroderma patients face. Singing creates more saliva in the mouth, which can help with dry mouth. When we sing, we are breathing differently. We're breathing from our diaphragm. We're breathing more deeply. So we're strengthening the diaphragm and improving our breathing and lung capacity over time. Singing, especially humming, helps to stimulate the vagus nerve, which is connected to virtually every organ in the body. So when the vagus nerve is stimulated in this way, it sends a message of relaxation and calm to every part of the body. So, and when we do this, we're also directly stimulating our parasympathetic nervous system, activity, which tells our body it's okay to rest and digest. So, for example, it can relieve issues with the GI tract, and aid in digestion, and of course help with pain management. So that's more of the physical aspects. The emotional and spiritual benefits. Hi, everyone. The emotional spiritual benefits can support coping, decrease anxiety and stress and feelings of isolation, can improve mood, can help with loss of identity and reclaiming your voice. It can facilitate emotional expression and connection with the body and emotions, stimulate self growth and awareness, increase energy and mental clarity, and connect to the parts of ourselves that are well. So, some common interventions, in general, music therapy, but also specifically for this population. You might see this replaying of music from one's life, um, music improvisation, songwriting, singing, chanting, toning, music relaxation, guided music and imagery. There's just lots of stuff. Music-based gift or legacy creation, and then creating intentional playlists. So today, though, out of all those things, we're going to focus on the voice, and we're going to focus on self-generated sounds, because that's what we can do, right? We have our instrument with us right here. Um, and I just want to remind folks that you do not have to be a singer to engage in these exercises. And I believe that everyone can sing. If you can speak, you can sing, and that each of us carries the most valuable instrument for healing with us at all times, our voice. So I went through that pretty quickly because I want to get to the experientials. But are there any questions yet at this point before we get into the experientials? Oh, let me just say really quickly on this slide, I forgot, I'm sorry. So let me just describe what these self-generated sounds are. So there's toning, the elongation of a sound, using breath and voice to voice, no matter the quality or pitch of the sound. So toning might be for example, and you might be sending that sound to different parts of the body. Seed syllables is a form of toning. Humming is also a form of toning. And we're going to be working with some seed syllables today. These are ancient sacred formulas of potent combinations of consonant and vowels that are charged with certain frequencies that move energy through the body and vibrate the different energy centers in the body. So those who are familiar with chakras, those are energy centers in the body. Other things that I do usually with some of my clients, we do some mantras, which is any empowered word or phrase that is chanted repetitively. But this is singing. Same thing with chants, which is usually a short song with a melody that may have a melodic variation and harmonies. Okay. So thank you, Lauren. Are there any questions so far before we move into the experientials? Lauren, I'm not sure if there are. Let me see what you have to say here. These sounds, okay, I'm going to read from Karen. These sounds will help with the raspy voice, question mark. As I have aged and dried out, in quotations, there is a raspiness to my voice, particularly singing. Thank you for that question, Karen. I hope I'm saying your name right. Yes, I think it can help. Like over time, I'm going to give you a few different things you can do, but one of the things that I will show you is I'm going to give an option for people, like if singing or humming, it's like hurts you, because the folks that I work with in New England Foundation, some of them, some of these exercises is sort of more, they felt like it was more irritating in their throat. So I always say, if that's the case, go back to just breathing, or I'm going to show you an exercise with water and a straw in just a minute. But over time, if you do it enough, I think that it can help with that raspy voice, especially if you're the toning, and like very intentional toning. And you would be working with somebody, working with a music therapist or even a voice therapist on this. That's what I would say. All right, next question is pinned here from Diane. If I wanted to find someone in my area to work with for music therapy, what credentials would I want to look for, and what questions should I ask? So you want to, in my bio, you can see you want to look for MT/BC. If they have MT/BC next to their name, that means that they are a credentialed and board certified music therapist. If they do not, I would not suggest working with them. I missed the rest of that question because it got unpinned. Oh, there we go. And what questions should I ask? I think I would ask, what is it that what are your goals? So like, if you're wanting to breathe better, whatever it is that your goals are, is like asking them if they can support you with those goals. Because all music therapists can work with tons of different populations, but there's some people that, specialize in certain things. Okay, thank you. So then we have the next question pinned are, what are examples of Sanskrit seeds? I'm going to get into that during our experiential, Zeba. So that's coming up. Was there any more questions? No more questions. Awesome. All right, y'all. Let's get into some experientials. So this is what I was just talking about, is this bubbles with no sound. So bubbles with no sound. I'm going to do, so this is a gentle exercise that you can do to improve breathing capacity without singing. And this is good, like I was saying earlier, for people even here today, or who find any of the singing, humming, or toning exercises challenging as we do them today. So if that's the case, you can always come back to this, but I mean, it would require you to go and get some water and a straw. But that's, if you can, or if you want to, you can do that, or just watch. I can also share this somehow with you all, this it's going to be video, it's being recorded. So this is a way that you can, it really does help if you're looking to help improve breathing. This is something you can do. So, you want water where it's like, where you just have 2 inches of water right here, and you place the straw and hold the cup close. I'm not going to hold the cup close to my body because I want to show you, but you place the straw in the mouth, in between your incisor teeth and your tongue, and you close your lips around the straw, keeping the tongue relaxed and slightly touching the straw. You take a deep breath in and inhale from the nose, like yawning with your mouth closed, thinking of the position of the vowel ooh. Let's see. Oh, we're getting feedback. Okay. Is this better? Is this better? I'll just keep talking. Is that better, Lauren? Is that better? Okay, good. I'm sorry. So actually, let me just move it this way so I have to get a little closer to there so I can see what I wrote on here. So on the inhalation, feel your diaphragm and rib cage expand, and exhale, blowing air through the straw. So it's like this. And you continue to blow the bubbles until you feel like you need to inhale again. Now, if you're going to do it with sound, you do the same thing, but you're going to create a sound on ooh. And you continue to make the sound until you feel again that you need to inhale. And continue to make the sound while blowing bubbles. And then you can slide the pitch from low to high. I don't know if you all can hear that, but so I wanted to give that as an option because it's a great, very gentle exercise, especially if your things are really, if you're really, sorry, there's, is there a problem again? Still static. Oh no. Okay, there's still static. If I move further back, let's see. Sorry, just 1 second, y'all. We're gonna figure this out. Try turning the mic on and off. Okay. Just give me 1 minute here. How's that? Okay. Whew. Thank you all for your patience. Okay, actually, I'm gonna not share that slide yet. Okay, so we're gonna. So that was just a tool I wanted to offer you all. And also for any people who any of these exercises bothers you in any way, stop and just go back to the breath. Or if you have a straw and some water, do that exercise. So if everybody wants to get into sort of a comfortable space or wherever you're sitting, let's just do just a few little stretches before we start, because it's always good to have the body a little bit, stretch before you start to sing so that the sound can flow. So just moving the head, doing slow, gentle head rolls to the right and to the left, and turning the head to the right and the left, rolling the shoulders back, rolling the shoulders forward, clasping your hands, reaching them up above the head, and just stretching the side body slightly. This helps stretching the spine and bringing awareness to the diaphragm. And my teacher used to say, a flexible spine means a flexible voice. So we want the spine to be awakened because the voice, the tones travel through the spine. Okay, and then just really quickly, just massaging the jaw. We hold a lot of tension here in the jaw, opening the mouth wide. Ah, ah. All right, everyone. So and again, Lauren, let me know if the sound is okay. Let's enter gently into these experientials, going ahead by just aligning your posture, getting grounded on our sit bones, relaxing the spine, the chin upright and parallel to the floor. Just taking time, just taking a moment right now in the middle of the day or kind of towards the end of the day, right? To settle in after all these presentations, right? Giving yourself the gift of getting comfortable, taking a nice deep breath in through the nose and feeling the body expand with the inhale, and then slowly exhaling through the mouth, feeling yourself emptying out. We'll do that a couple more times. So deep breath in through the nose, and then slowly breathe out through the mouth. Allowing yourself to arrive, noticing any aspects of your energy or your mind that are soaring or preoccupied. Gently encouraging yourself to come into this moment. Calling back pieces of yourself you may have left in other situations from your day. Allowing your breath to go back to its natural rhythm. Really feeling the chair beneath you, the floor beneath your feet. Imagining that your pelvis is an anchor, feeling its weight pressing down on the chair, feeling the bowl of the pelvis, the belly, the hips, and that from that anchor, feeling the spine nice and spacious. You might even feel the crown of the head reaching to the sky, the shoulders relaxing down and away from the neck and the ears, the jaw and cheeks softening, the tongue softening, feeling your eyes and forehead softening. Taking a moment to feel the sensations in the body. Where do you feel pain or tension? Where might you feel openness and expansion? And just noticing these sensations without judgment. And if you would like to, you can keep your eyes closed or you can keep your gaze lowered and continue to stay in this internal space as we do the first exercise, which is humming. So we're going to take a deep breath in from the belly. We're going to breathe here from the diaphragm, right? And we're going to breathe in and hum with our lips pursed, push forward, almost like you're giving a kiss, right? And you can do it on any note, or you can do it on the same note as me. And so what this does is it pushes the sound up into this area, which then helps to stimulate the vagus nerve much, much, much easier. So that's why I'm asking you to do this, because it's just much more effective and we'll have better results for the humming. As we start, just notice again where your body is at, how you're feeling in this moment. And we're going to do this for a few minutes, taking a deep breath in through the belly. So take a moment to just be in silence and notice if you feel, it was very short time, but notice if you feel any changes in the body from before you started. Usually I suggest doing humming for at least 5 minutes and working up to 10 minutes a day. So I am going to, when you're ready, you can slowly open your eyes, coming back to the space if you haven't already. I'm just going to talk a little bit about humming and the power of humming. I think it's one of the most powerful tools that we have, because we can do it anywhere, and we all can hum for the most part. So it's so simple, humming, but it's one of the easiest ways, like I talked about, to stimulate the vagus nerve. Um, it can help with sensory integration, creating more cooperative balance between both hemispheres of the brain, help us to breathe better, can relieve the GI tract issues and aid in digestion, can help you feel more alert and balanced. And like I said before, stimulates the parasympathetic nervous system. So it helps us to relax and to get calm in the body. Um, if you're interested in humming, if this was a good exercise for you, I suggest doing it on an empty stomach in the morning, maybe 10 minutes before you start your day, starting 2 minutes and starting 5 minutes, like working up to 10 minutes and just seeing how it changes your day, how it changes your symptoms. Um, if there's any questions about humming, I can take those right now. Or if anybody wants to share their experience in the chat about how that affected them, the humming, we can do that right now. I would have loved to have, we have a question from Chris. I would love to have something like this at a life support group meeting. Thanks. Yes, I mean, that's what I'm doing. I do music therapy support groups. Here, I live in Boston. So I do it for the New England Scleroderma Foundation. We do monthly music therapy support groups. So I'm not sure where you live, Chris, but that's one place that you can experience that. Maureen says, "I love to hum, and this was a great session, Erin. Thank you so much." You're welcome. Zeba, did you have your mouth slightly apart? And also, is it one tone, or can you go up and down with tonal elements? Great question. So what I was doing was what I was telling you was kind of pursing your lips. I'll get closer. Which brings the sound up into this area, right? And that helps to stimulate the vagus nerve. So my mouth wasn't really slightly apart. Maybe it looked that way, but it might have been maybe slightly. I wasn't trying to, but and you can go up and down. Yes, I was just trying to keep it simple, but you definitely can go up and down. You can do following your voice. You can do yeah, you can play with it. Make it fun for yourself. All right. Yeah, so I forgot. Thank you, Sherry. She says beautiful and relaxing. Yes, very relaxing. Good. So the bowl I'm playing, I'm not showing it to you. It's gonna be too hard to lift everything, but I'm playing a crystal bowl, I'm playing Tibetan singing bowls, I'm playing a Shruti box, which is from India. That's the drone that I tend to use when I'm working with the voice often. I actually feel like I had a cat nap and a slight jolt of energy. Isn't that interesting how let's see, isn't that interesting how you feel relaxed and energized at the same time? This is what this work can do, and I really love that too. Zeba, so the air was not coming out. You were holding, so the air was not coming out. You were holding our breath. I thought you were letting the air out. Yes, I'm letting air out. Yeah, as I'm humming, I'm letting air out. So I'm taking a deep breath in And then I'm toning on the hum, right? So taking a deep breath in, you can breathe in through your mouth or your nose. I breathe in through my mouth, but breathing in through the mouth and then so the air is coming out of my nose. I'm slowly letting the air out of my belly. Suggestions for someone who has such a small mouth and sound doesn't really come out. Um, the bubbles, this that I mentioned earlier, you don't even need sound for that. That can help with breathing and breathing capacity. Um, if the humming doesn't work for you, Eva Marie, then maybe this next one will work because the mouth will be open. So so you might be able to get more sound out. So it might be that humming won't work for you, but maybe some of these other exercises will. So I'm going to go to the next slide here. We can proceed. All right, awesome. So this is what someone asked earlier. I think it might have been Zeba. So what we're going to work with is toning, but I'm going to use seed syllables to do that. So seed syllables are ancient sacred formulas of potent combinations of consonants and vowels known in many cultures, already charged with the healing power of that particular lineage. So they're charged with certain frequencies that move energy through the body and vibrate the different energy centers. I put the chakra system right here so you can see with the image what the different energy centers are if you're not familiar with the chakra system. I'm going to introduce you to Hindu seed syllables, but there's so many different types of seed syllables. You have Tibetan five seed syllables of the warrior mind. You have in traditional Chinese medicine, they have seed syllables that stimulate. I really love that practice, and I use that a lot with my cancer patients. But they have seed syllables that stimulate and tone different organs in the body. But today we're going to tone using seed syllables from the Hindu tradition that connect the physical and the subtle body and balance the energy centers. They're called seeds or bija in Sanskrit because when we intone them, they emulate the moment of conception of feminine and masculine energy in the production of sound. So the vowels are more open and receptive, and the consonants are more sort of piercing. So the female and male aspect. So when you make each sound, we're gonna send that sound to the area of the body that I mentioned, and you're gonna tone on the vowel a little bit longer than the consonant. So we're gonna repeat each syllable 3 times, and we're gonna start with the first chakra or the root chakra, which is at the base of the spine. And so, for example, the first syllable is lam, L-A-M, and it would sound like, with my Shruti box, I'll just do it. It would sound like la. So I know that people might have trouble holding out notes for a long time. So what I want to suggest is if you can only do it for a few seconds, that's fine. Just do it as long as you can, taking a deep breath in from the diaphragm. So if it might just be la, whatever you can do today is great, so just do your best. I'm a singer, so I have worked with my breathing for a long time, so I can hold notes out for a long time. So I am not you don't have to do what I'm doing, like as long as I'm doing it. I'm not going to try to hold it out as long for that reason. All right, everyone. So here's our next experiential. Here I have the list of the seed syllables from the Hindu tradition. So you can see them. I'm going to say what they are, but at least you can see them on the screen. So if everybody wants to get back into that sort of meditative internal space, if you like to, you can close your eyes again. Really, tuning back into the body. And I want you to bring your awareness now to the base of the spine. And this area is related to our survival. It's where we find grounding and security. We're going to send the sound lam, L-A-M, 3 times to the base of the spine. La. Again, you do not have to do the same note as me. If you want to go higher or lower, that's up to you. Whatever feels good in your body. Now moving to the second chakra, or the sacral chakra, which is the lower abdomen area, bringing your attention there. If it feels good, you can put your hands in these areas. So you can put your hands on your lower abdomen. This is related to the realms of emotion and creativity and sexuality. We're going to send the sound of VAM, V-A-M. Ba. Now bringing your awareness to the third chakra and the solar plexus area right here under the breast. This is related to our identity, our power, our sense of confidence. We're going to send the sound Ram, R-A-M, to that area. Now bring your awareness to the heart area again. If you want to put your hands there, feels good. This is related to love, relationships, intimacy. The seed syllable is Y-A-M, yam. We're going to send that to the heart. Now bringing your awareness to the throat area. This is related to our communication and our self-expression. And again, I know for people who have issues with the throat, this might, as you're doing this one, this might be hard. So just know that's okay. And if you need to stop, that's fine. Sending the sound H-A-M, hum, to the throat. Now bring your attention to the forehead, or the third eye, right here in the middle of the forehead. This is related to our vision, our intuition, our insight, this area of the body. We're going to send the sound Om, O-M. inhale, bring your attention and awareness to the crown of the head. This is related to our consciousness, our awareness. And this is just ah, open vowel, ah. I tend to sing this a little bit higher. It feels like I can resonate that area better when I sing it higher. So again, let's just take a moment to just be in silence, checking in again with the body and just noticing what may have, how the body feels now, remembering what came up, if there's any sensations or emotions or anything that came up in the different areas of the body as you went through that. Again, this helps with body awareness, connecting to the body, connecting to emotions, and also can help with breathing. It can help with a lot of different other things that I had mentioned earlier. So I just taking a moment to notice how it affected you. And you may not have had a good experience either. Just it's everybody's different, right? So this is one version of toning with seed syllables, but you can tone on any vowel, oo, ah, e, o. You can send that toning to different parts of your body that are experiencing pain. Say I have pain in the knee, I'll send a sound, and it's like intuitive. But if you work with a music therapist or someone can work with you to figure out how to use sound that's specific to you. So if anybody wants to have questions about that or want to share their experience, this would be the time. They want to share their experience of that exercise. It cleared my throat, Isabel says. Awesome. Zeba. Bija means seed. Yes. Let's see. Elaine says, in Qigong, yes, they have seed syllables in Qigong. I think they might be similar to what I was talking about in Chinese medicine. Are these particular sounds for the organs, or maybe it might be something different? But yes, there's seed syllables in all different traditions. Mary says, thank you so very much. This is so relaxing. Awesome, Mary. Thank you. Leslie, hi Leslie. Saying this is so wonderful. How do we begin to do this at home ourselves? Good question. I would definitely be happy to. What I do with my clients is I record stuff so that they can do it along with me, because sometimes people have a hard time doing it with them for themselves. If you don't have that, what I would suggest is you can get 15 minutes. Thank you. You can get drone sounds like on Spotify or whatever, however you get your music. There's you can get like I use sometimes recorded drone cello sounds, and in different, they have them in different keys. So if you're not going to have a Shruti box like I have here from India, which costs a lot of money, you can just play, a track and do some of these exercises along with that, right? So you can hum along with it. You don't even need a track to hum, right? You just hum. The easiest thing to do is just start a humming practice every morning and building up to 10 minutes in the morning, right? Or whenever you would like to do it, in the evening or whatever's a good time for you. The other thing is like getting some kind of recording that will help support the voice and toning. I like to tone using seed syllables. I think I can share this. Can I share this PDF with everybody? Then they could have at least these seed syllables. But so that's one way of doing it, or just intuitively, just using regular, so like ah, ooh, oh, and just intuitively sending that sound to a part of the body that is tense or is hurting or is in pain. So those are a couple ideas of how to do it at home. Let's see. Catherine says, I felt constriction in the throat chakra. I'm not going to say that right, but you sometimes choke when you try to sing. Yeah, so this is what I have. I've had some other scleroderma clients that say that. So that's when I recommend to go back to this. So you can, if you know, if you're starting to feel irritation or constriction, going back to the bubbles and trying to make sound through the straw and seeing if that is not constricting to you, because you're going to get a lot of the same benefits by doing that. I don't know if that helps. So you're still singing, but it's the way that you have to have the throat open in this way. It helps with the constriction when you do that. So, Catherine, I don't know if that answers your question. YouTube, Millie says YouTube has great music similar to this. Yeah. Yes. Yeah. Leslie, does the intensity make a difference to comfort? I'm not sure what you mean by that. Does the intensity make a difference to comfort? I.e., like not so loud. Do you mean, Leslie, like in terms of, oh, I see what you're saying. Thank you. So you mean in terms of singing, like if you sing softer, maybe that's more comfortable for people. Yeah, I would say, if that's what you're asking, I would say yes, play with that, like play with levels, the dynamics. I think that's what you're asking about, the dynamics of the voice. You can play with the levels of the dynamics of the voice. That might help in terms of the irritation. Um, yeah. Did did that answer your question, Leslie? Let's see here. Um, could you give? Yeah. So yes, I mean, I know many of you may not practice Eastern religions. So that's why I'm saying you can tone without it not being connected to any sort of tradition or religion. I don't know if that is what you were asking about, Lauren, but um, other religious vocal traditions. Yeah, I mean, there's so many, there's so many different things I could talk about, but I tend to focus on non-Western traditions because that's actually is not what is very present in the music therapy field. And I find that it actually helps us to get out of our Western ways of approaching the voice. So I do a lot of like work with Brazilian traditions and African traditions, and there's a way that the way that those languages open up the voice more. Um, yeah. So it says, Erin, can you please show the page with the human body chakras? Yeah, no problem. That one? Yeah, there you go. I feel like, Isabel, I feel like my body is resonating, especially my head area. Yeah, you might feel like you're vibrating, right? Yeah. So, does anybody have any other questions about anything? We have about 10 more minutes, I believe, and um, we can use the rest of the time for questions, but I did want to end with just this mantra, a chant, sorry, not a mantra. So let me know, let's see, if you have a questions, or not even questions, if you want to share what your experience was of either the humming or the toning, even if it was not a good experience, because it helps me to know. I can, yes, so that's what I mean. Isabel wrote, this is helpful because when she's been feeling depressed. So you'll be amazed. When I work with people, I try to do sound for at least 20 minutes or more, because after about 20 minutes is when the body really starts to shift, and you'll notice a shift in your mood. You'll notice all these physical shifts, because that's just the power of singing it, and this kind of therapy. Zeba, good experience makes the head lighter. Good, thank you, Zeba. Leslie, so helpful for me with down feelings and also with low energy or if I'm upset. Yes. And I think someone mentioned earlier, like, I feel relaxed and energized at the same time. And that's what these exercises can do, especially the humming does that quite a bit for people. But going and the way I work with people is I start like I kind of did that with you, but because it's more of a presentation, it's not exactly the same. But I usually work with, we kind of take a journey together. So we start with grounding and breathing, moving into humming, moving into some sort of toning or seed syllables. It might depend. And then I might do some vocal meditation with folks. So it's like just sort of exploring the voice and letting the voice go where it needs to go. Then moving into a mantra and then moving into a chant or moving into some sort of songwriting practice together. So that's kind of gives you an idea of how like a group, I might do a group session. And usually my group sessions will have some sort of theme, usually. So we might be working with grief or a particular element that is related to a particular emotion. And so, and then, it also relates to the physical aspects. And so, yeah. Any other questions or any other questions or comments before we maybe just end today with a chant? Can you repeat the bubble exercise just in case people missed it? Yes. So there's bubbles with no sound. You're putting the it's hard to do it and say it at the same time. So you're placing the straw in your mouth with your lips around the straw, and you're kind of you're thinking of like the position of the vowel oo, but you're not making the sound, if that makes sense. And so you're breathing in and then breathing out through the straw with that idea of that you're like doing ooh, but you're not really doing ooh. I mean, you're not sounding it, but it's the shape of your mouth is. And then with sound, you're doing the same thing, but you're making sound on ooh. And then you can go up and down, like I'll do it without the straw, but it's like ooh, but you're doing it through the straw. Ooh, I just did that really. I got water all over my face. um, did that help, Lauren? In terms of maybe if people missed it, that was okay. That was a exercise for people. If singing is irritating your throat or is making the throat close up or is causing any pain in any way, going to that exercise is will really help. Maribel, when I have a high fever, I hum, which seems to happen a couple times a year. I don't know why I do it. When I exhale, I just hum, and I feel like it makes me feel better, which doesn't make sense to me. But does it make sense to you now after I talked about the power of humming? I'll go back to that slide. It tells you why the power that humming is so powerful. All right, y'all. So we have 5 minutes until we end. Before I start the chant, is there any other comments or questions? You could go ahead and put that in the chat. As a Christian, I used to get stuck with the belief behind this type of practice, but then I realized it can be used with any belief system. Yes, thank you, Millie, for saying that. Yes, this is not about a belief system. To me, this is about, in the way I use it, is about it's a technique. Just like Lisa just wrote, that these are great techniques to try. It's a tool and a technique to help you with all the things that I mentioned that this can help you with. And so it doesn't have to be spiritual or religious. It doesn't necessarily have to have a spiritual religious connotation. So let's end today with, so I had plenty of things I'm not going to teach this one, which is a Buddhist Tibetan chant. I'm going to do one that is by I would really recommend this group called the Beautiful Chorus. They have these beautiful, simple mantras that in English that are just wonderful, and you can find them on Spotify. And so I'm going to show you one today, and I would love if you all join in. So I'm just going. This is how we're going to end today. And thank you all for your questions. Thank you all for your comments and for your presence. I did feel you, even though I could not see you. All right. So it's called I Am Enough by the Beautiful Chorus. I see myself in joy and love. I know myself. I am enough. So just join in once you get the melody. I see myself in joy and love. I know myself. I am enough. See myself in joy and love. I know myself, I am enough. See myself in joy and love. I know myself, I am enough. See myself in joy and love. I know myself. I am enough. Thank you all so much. If you want to reach me, here's my email, eraber.musictherapy@gmail.com. Thank you all. I know we're like 10 seconds away from time, so just want to say thank you.